My full name is Githanjali Aurora, and but I go by my nickname Tanya. I am an associate professor at Keck USC School of Medicine and an attending physician at Children's Hospital Los Angeles on our comfort and palliative care team. My pathway is windy. I knew that I wanted to be a pediatrician when I was 3 years old, which I realize is uncommon. I have a younger brother. He's only 3 years younger than me, and he's perfectly healthy now. But as a baby, he had several medical problems and required hospitalization. And I remember going with my parents to the hospital. It must have been one of my earliest memories. And I was very nervous because I had been so looking forward to having a little brother. And then now he was going back into the hospital. And I remember a very tall man who might not have been that tall, but to my 3-year-old self was very tall and in a white coat. And he knelt down at my level and he said, "We're going to do the very best we can to take care of your brother." And I thought in that moment, I want to be that person. I want to be the kind of person who's going to take care of my brother. And I had only really thought about it in that context of wanting to be a good big sister and wanting to help make him well. And I said, I want to do that. And then throughout my life, I kept saying, I think I want to do that. I want to work with kids in that way. I don't have any doctors in my family. So I sort of just was mentored by friends' parents who were doctors. I grew up in Los Angeles and I started volunteering at Children's Hospital when I was a teenager. I was very fortunate to be paired with a mentor there who really encouraged me and helped guide me and still continues to guide me along my pathway. And then I went to college and I then applied to medical school. And came back to Los Angeles USC for medical school, and then did my residency training at Children's Hospital Los Angeles. And then there I was a pediatrician, and I didn't know what to do. I really liked taking care of kids in the hospital, but I didn't really want to be an ICU physician. There wasn't a specialty of palliative care at that time. And I don't even know that I could have pursued that at that time. So I thought, okay, what are the things I like to do? I like a little bit of general peds. I like a little bit of hospitalist-based medicine. I did some of that for a while. And then I thought, I've always wanted to work internationally. So let me do that before I think about having children of my own. Let me go work internationally. So I worked with Doctors Without Borders for a couple of years, and then came back and worked as a hospitalist with children with high levels of medical complexity, and then did global health. So my job was split. I was working in very resource limited settings with high rates of morbidity and mortality, and in very well resource settings with high rates of morbidity and mortality. And there was something emerging in both of those contexts that felt like I was the same person doing very similar work, even though the resources were so different. I think in both settings, it really required partnership with patients, partnership with families, partnership with communities. I understood that I couldn't do the work on my own. I really needed to listen and to hear what the priorities were for that patient, that family, and that community. And only then could I step into engaging in the work. So I thought, well, what area of medicine would allow me to refine those skills of partnership? And then I fell in love with palliative care. And in those visits, I thought, this is what I wanted to do when I was 3 years old. And I wanted to be that person who would take the time to kneel down and to talk to a sibling. I wanted to be that person then, and I still want to be that person. And it's been 7 years of working in palliative care.